Food safety is very important during cancer and cancer treatment because often the immune system has been compromised. So with any type, you're more likely to risk infection with food germs or germs in other situations. So the first thing to do with food preparation is to make sure you wash your hands every time you're dealing with food and that everybody else around you washes their hands well. I'm taught that if fruits and vegetables are washed well, then they're safe. To not eat anything that's moldy or has spots on it or looks the least bit overripe, but wash them well with water. And again, I've always been taught to just wash them with lots of water, that you don't need any type of special product, and it's best generally to not use a special product. Patients have asked me about bleach rinses and how about a little, yesterday, soft soap with water. And what you need to realize is that can be left on the produce, and you don't want to be consuming bleach or soap. Just lots and lots of water is perfect. Some other ideas important for food safety would be to make sure to use separate cutting boards for produce and for meats. Wash them thoroughly after each use. Remember to avoid any raw or undercooked foods, meats. No raw eggs, that means no cookie batter or cookie dough for now. Not recommended any time, but especially not now when the immune system can be compromised. Any unpasteurized foods would not be recommended now. Any type, even raw honey is not recommended. That type thing. Just well-cooked foods. I get a question from patients all the time, does sugar feed cancer? Or other patients that will come to me that have been diagnosed and say, I don't eat sugar, how did I get cancer? And I said, well, it's because we really don't have the science to say that sugar causes cancer or feeds cancer, other than to say it's quite correct to say that sugar in the form of glucose feeds all of our cells. And if I didn't eat a bit of sugar or carbohydrate, my body will still get sugar, glucose, to manage my body's systems. It can break down your own protein, and it does that. And there's a biochemical term, gluconeogenesis. So I know it's all over the internet and popularly believed, but we don't have the science to say that. And with that, I still tell patients in the next breath, it's very important that they try to eat well and minimize added sugars just because they don't have any nutritional benefit. Yes, it's not been shown to be helpful. Sugar has not been shown to be helpful for any, and it's thought to be linked to inflammation, so it's a good idea to limit it. But it can be stressful for patients when they're trying so hard to limit every sugar and they're looking at labels, and maybe sometimes they're afraid to eat fruit because they're so concerned and afraid to eat, and the stress itself actually can raise their sugar. So it turns out to be not so helpful to worry about it as much as they do.